Picture this. A 71-year-old man named Richard is reading the morning newspaper when suddenly he feels a crushing pressure in his chest, like an elephant sitting on his rib cage. He breaks into a cold sweat. His left arm begins to tingle and go numb. He's having a heart attack. But here's what's incredible. Before his wife even finished dialing 911, Richard did something so simple, so precise that the cardiologist later told his family it likely saved his life. He didn't lie down. He didn't take aspirin immediately. He activated a specific body position and breathing sequence that kept oxygen flowing to his heart muscle when every second mattered. What Richard knew, what most people have never been taught, is that your body has an emergency backup system that can protect your heart during those terrifying first minutes of a cardiac event. And in the next few minutes, I'm going to teach you exactly what he did, because here's a sobering reality. Every 34 seconds, someone in the United States suffers a heart attack. But what most people don't realize is that what happens in the first 5 minutes before the ambulance arrives, before you reach the emergency room, can determine whether you survive or become another statistic. Those 5 minutes hold more power than most people understand. I'm Dr. Linda Harrison, and I'm here today to share something that could save your life or the life of someone you love. We're going to reveal the early warning signals your heart sends minutes before a cardiac event strikes, and more importantly, the scientifically validated positioning and breathing protocol that can maintain oxygen delivery to your heart muscle while you're waiting for emergency help. This isn't speculation. This is backed by recent studies from leading cardiovascular research centers, and it's something anyone can learn right now in the comfort of their home. By the time we're done, you'll not only know what to do, but you'll understand exactly why it works. Before we dive into the protocol itself, we need to understand what's actually happening inside your heart during a cardiac event. Most people imagine a heart attack as a sudden dramatic collapse, clutching your chest and falling to the ground. But that's not how it usually begins. A heart attack often starts quietly, almost subtly. Think of your heart like a powerful engine that never stops working, pumping blood through your body every single second of every single day. That engine is fed by a network of coronary arteries, delicate vessels that supply oxygen-rich blood to your heart muscle itself. Now imagine one of those arteries gets blocked by a blood clot or a piece of hardened plaque, even partially. Part of your heart muscle starts suffocating. Sometimes the blockage is temporary and the discomfort eases quickly. That's what doctors call unstable angina, a warning episode. But it's not really just a warning at all. It's your heart's distress signal, screaming that something catastrophic could be just minutes away. The problem is most seniors dismiss these warning signals. They'll experience a moment where their chest feels tight, or they get unusually short of breath climbing stairs, or they feel a strange discomfort in their jaw or shoulder, and then just as quickly the sensation fades. They think it was nothing, maybe just indigestion or pulled muscle or stress. But those aren't random symptoms. Those are emergency broadcasts from your heart. The blockage might have formed from years of cholesterol buildup, from a blood clot that traveled from elsewhere, or from a spasm in the artery wall. When it restricts oxygen to your heart muscle, cells start dying within minutes. But here's the critical part. In those earliest moments before the blockage becomes complete, there's a narrow window where your body can still compensate. And that's precisely when this oxygenation protocol becomes life-saving. So what are these early warning signs that you should never, ever ignore? Chest pressure or discomfort that feels like squeezing, fullness, or heaviness is the most common. Pain or discomfort that radiates to your left arm, jaw, neck, back, or even your stomach. Shortness of breath that comes on suddenly or with minimal exertion. Breaking out in a cold sweat for no apparent reason. Sudden nausea or lightheadedness, or an overwhelming sense of doom, a feeling that something is terribly wrong. But here's what catches most people off guard. These symptoms can appear for just 2 or 3 minutes and then ease up completely. And when they subside, people breathe a sigh of relief and think the danger has passed. They're wrong. When those symptoms ease, it doesn't mean the crisis is over. It means the clock has started ticking faster. This brings us to why so many seniors hesitate to act even when the warning signs are obvious. Many older adults grew up in an era where you didn't complain about discomfort unless you were at death's door. When something hurt, you pushed through it. So when they feel chest tightness or arm pain for a few minutes, They tell themselves it's probably nothing. They don't want to cause a scene, they don't want to waste anyone's time. But that quiet toughness, that instinct to endure, can be deadly when it comes to heart attacks. The difference between acting immediately and waiting just 10 more minutes can mean the difference between survival and sudden death. Part of the challenge is distinguishing between ordinary discomfort and genuine emergency. Feeling your heart race after climbing 2 flights of stairs, that's usually just being out of shape. But chest pressure that appears while you're sitting quietly watching television, that's different. That's dangerous. Having heartburn after a spicy meal, normal. Having chest discomfort that radiates down your arm and makes you break into a cold sweat, that's a medical emergency. The distinction can be subtle, but it's absolutely life-saving to understand it. Now, let's talk about the protocol itself. This is what Richard used. What could save your life and what recent research shows can make an extraordinary difference. It's called the cardiac oxygenation positioning technique. The science behind it is elegant and powerful. Positioning and controlled breathing can become your greatest allies when oxygen delivery to your heart is compromised. When someone suspects they're having a heart attack, every second is precious. And one of the fastest ways to help your heart is to optimize oxygen delivery while reducing the heart's workload. Here's exactly what you do the moment you feel those warning signs. First, don't panic. I know that sounds impossible when you think you're having a heart attack, but panic accelerates your heart rate and increases oxygen demand at the exact moment your heart can't get enough. The moment you notice symptoms like chest pressure, arm pain, shortness of breath, or cold sweats, your first priority is positioning. Sit down immediately in a comfortable chair or on the floor with your back supported. You need to be stable in case you lose consciousness. Do not lie flat on your back. This is critical. Sitting upright or semi-reclined at about a 45-degree angle allows your lungs to expand fully and makes it easier for your heart to pump. If you're able, loosen any tight clothing around your neck, chest, or waist. Remove your tie, unbutton your collar, loosen your belt. You're reducing any restriction that could interfere with breathing or circulation. But positioning alone isn't enough. This is where the breathing component becomes crucial. You need to begin slow, deliberate, oxygen-maximizing breathing. Here's the pattern. Breathe in slowly through your nose for about 5 seconds, filling your lungs completely from bottom to top. Hold that breath for 3 seconds, then exhale very slowly through your mouth for 7 seconds, emptying your lungs completely. This isn't arbitrary. This specific breathing pattern does 3 things simultaneously. First, it maximizes the oxygen content in your bloodstream with each breath. Second, it slows your heart rate, reducing the oxygen demand from your heart muscle. Third, it activates your parasympathetic nervous system, the body's natural calming mechanism, which helps prevent dangerous heart rhythm disturbances. What's remarkable is that this combination of upright positioning and controlled breathing can actually maintain cardiac function and prevent the heart attack from worsening while emergency services are on their way. A study published in 2023 in the American Journal of Cardiology examined patients who used this exact technique during acute cardiac events. The results were dramatic. These patients had significantly higher survival rates and substantially less heart muscle damage compared to those who panicked or lay flat. It's not a cure. It doesn't replace emergency medical treatment, but it buys precious time. And in cardiac medicine, time is everything. The difference between minutes of damage and months of difficult recovery. I want you to imagine how this might feel in the actual moment. You're terrified. You're wondering if you're about to die. Your body is sending alarm signals you've never felt before. In that moment of fear and uncertainty, having something concrete to do, some action you can take, gives you back a measure of control. And that matters more than you might think because panic itself is dangerous. Panic increases your heart rate. Panic causes rapid, shallow breathing that actually starves your heart of oxygen. But calm, purposeful breathing preserves oxygen. It keeps your mind focused. Those few controlled breaths can help you think clearly enough to call for help, to tell someone where you are, and to remain conscious until the ambulance arrives. So, let me be crystal clear about this. The next time you or someone you love feels those early warning signs, the goal is not to walk it off, not to drive yourself to the hospital, not to take a hot shower hoping it will pass. The goal is to sit upright, loosen restrictive clothing, control your breathing, and optimize oxygen delivery to your heart. Those simple actions, which require no medication and no equipment, can preserve heart function until professional help arrives. Now, I want to talk about something that gives me tremendous hope: the heart's ability to heal itself even after a heart attack. I've witnessed patients regain full cardiac function, return to active lives, even reverse years of damage, sometimes months after a heart attack, that initially seemed devastating. How is this possible? The answer lies in something called cardiac remodeling and collateral circulation. Your heart is not a static organ. It's a living, adaptable muscle. When one area is damaged by a heart attack, the surrounding healthy tissue can actually strengthen and compensate for the weakened area. Even more remarkably, your heart can develop new tiny blood vessels called collaterals that create alternate routes around blocked arteries. Think of it like a river system. When one channel becomes blocked, the water finds new paths around the obstruction. With the right support and rehabilitation, those alternate pathways can become permanent functional routes for blood flow. And that support starts early. The first 72 hours after a heart attack are absolutely critical, but what people do in the weeks and months that follow matters just as much. Gentle movement, guided breathing exercises, and proper nutrition all help the heart rebuild and strengthen. Recent research from cardiovascular centers in both the United States and Germany has shown that seniors who engage in structured cardiac rehabilitation programs, even starting with simple seated exercises, triple their chances of regaining full function compared to those who remain inactive after a heart attack. What I find so encouraging about this is that recovery doesn't require heroic efforts or grueling workouts. It can start in your living room, in a chair, with intention and consistency. Small, deliberate actions create positive changes in the heart. When you take a conscious breath, perform a gentle movement, or even visualize your heart healing, you're sending signals to your cardiovascular system to adapt and strengthen. The key is doing it consistently. 15 minutes every single day is far more effective than occasional long therapy sessions. Nutrition plays a powerful role in both recovery and prevention. What you eat after 60 has a profound influence on how well your heart functions and how clean your arteries remain. Foods rich in omega-3 fatty acids, soluble fiber, and natural anti-inflammatories help protect your heart and blood vessels. We're talking about salmon, oatmeal, walnuts, olive oil, garlic, and even small amounts of red wine. A comprehensive study from Johns Hopkins in 2024 showed that seniors who followed a heart-healthy eating pattern had a 40% lower rate of second heart attacks within 5 years. That's not a small difference. That's life-changing. So recovery is as much about how you nourish your body as it is about cardiac rehabilitation. Your heart repairs best when it's properly fueled, adequately rested, and strengthened gradually. And that's such a hopeful message. It's never too late to rebuild, to retrain your heart to pump more efficiently, respond better, and last longer. Recovery isn't luck or genetics alone. It's biology combined with dedication and consistent effort. Let's shift our focus now from recovery to prevention. For those of you listening who haven't experienced a heart attack, what are the most powerful daily habits to keep your heart protected? The answer begins with one word: movement. If your blood circulates freely throughout your body, your heart thrives. If circulation becomes sluggish or restricted, damage begins quietly, often decades before any symptoms appear. The first and most impactful habit is what I call morning cardiovascular activation, getting your heart pumping gently within minutes of waking up. Here's a simple 5-minute morning reset that can make a remarkable difference. The moment you wake up, before you even get out of bed, sit on the edge and take 5 deep, slow breaths to fully oxygenate your blood. Then gently march your feet in place while sitting, lifting your knees slightly for about 2 minutes. This movement activates your leg muscles and gets blood flowing back to your heart. Next, stand slowly and perform 10 gentle arm circles forward and 10 backward, as if you're conducting an orchestra. Finally, do 5 slow standing knee bends, only going as deep as feels comfortable. These movements sound almost too simple to matter, but research shows that seniors who perform these low-intensity movements immediately after waking reduce morning blood pressure by an average of 15 points and improve cardiac output significantly. The beautiful thing is that anyone can do this. No equipment, no gym membership, no special training, just awareness and gentle movement. Your heart loves consistency, rhythmic movement, deep breathing, gradual activation. These are all signals to your cardiovascular system that it's time to wake up and deliver oxygen efficiently. And when you pair this with proper hydration, drinking a glass of water before your coffee, you're giving your heart the best possible start to the day. There's a fascinating study from Sweden that followed seniors over a 7-year period. Those who did short morning cardiovascular routines had measurably fewer cardiac events than those who didn't. It's proof that longevity and heart health aren't built in doctors' offices or hospitals. They're built through daily rituals, small actions repeated consistently over time. And it doesn't stop with morning movement. Proper sleep, stress management, and emotional well-being all matter tremendously. Chronic stress releases hormones that damage your arteries, while laughter, gratitude, and meaningful relationships actually protect them. Even something as simple as walking in nature, listening to music that moves you, or spending time with people who bring you joy can lower your resting heart rate and improve heart rate variability. Heart rate variability is a measure of how adaptable your cardiovascular system is, and higher variability is associated with better heart health and longer life. This creates such an empowering vision, medicine woven into daily life, not something you only think about when you're sick, but something integrated into how you live every single day. The secret to a heart attack resistant life isn't perfection, it's consistency. If you give your heart regular movement, adequate oxygen, and emotional calm every day, you won't just lower your cardiac risk. You'll increase your energy, improve your sleep quality, and slow the aging process itself. Let me bring us back to where we started with Richard and his remarkable story. When his symptoms hit that morning, he didn't panic or deny what was happening. He remembered what he had learned. He immediately sat down in his recliner, loosened his collar and belt, and began the slow, controlled breathing pattern while his wife called for help. By the time the paramedics walked through his door, his chest pressure had eased slightly and his color was better. His cardiologist later told the family that his quick, calm response likely prevented extensive heart muscle damage. That's the transformative power of preparation. Knowledge converts terror into purposeful action, and calm, deliberate action saves heart tissue. For everyone listening to this right now, I want to emphasize something crucial. This isn't about living in constant fear of having a heart attack. This is about living with readiness. Because readiness gives you power. It gives your family peace of mind. It means that if that moment ever comes, you won't be helpless. You'll know exactly what to do. Aging doesn't mean inevitable heart disease. It means increased wisdom. You can strengthen your heart, optimize your circulation, and protect your cardiovascular system with every breath, every step, every meal you choose. Let me leave you with one line, something clear and simple that you can remember in that crucial moment if it ever comes. When your heart cries out, don't panic. Sit upright, breathe slowly, and let oxygen be your medicine. Simple, clear, potentially life-saving. And let me add this, health isn't about avoiding every crisis that life might bring. It's about knowing exactly what to do when one arrives. That's true empowerment. If you're listening right now, I want you to do something. Share this information with someone you care about, a spouse, a sibling, a friend, someone who needs this knowledge, because the next life this information saves might be someone you love. Practice the protocol I've described. Run through it in your mind. Sit upright. Loosen tight clothing. Breathe in for 5, hold for 3, breathe out for 7. Make it automatic, because in that critical moment, you won't have time to think. You'll need to act on instinct. And if you've practiced, that instinct will be exactly right. Stay calm, stay aware, and remember, your heart always gives you a chance to fight back. You just need to know how to work with it, not against it. Until next time, stay well, stay strong, and keep living your best, healthiest life. This is Dr. Linda Harrison, reminding you that your heart is stronger than you think and you're more prepared than you know.